Apologies have been received from Malachy O'Hara, Senator O'Hara, and parliamentary privilege is considered to apply to the utterances of members participating online in a committee meeting when their participation is from within the parliamentary precincts. There can be no assurances in relation to participation online from outside the parliamentary precincts, and members should be mindful of this when they are contributing. The topic of our meeting today is engagement on decriminalisation, depenalisation, diversion and legalisation, international comparisons. The committee members are very interested to learn from the experiences of other drug policies within other countries, so we'd like to welcome all our witnesses who are joining us here today by teams. Dr. Ricardo Baptiste, founder and president of Unite, and Beatrix Voss, drug policy coordinator of Unite. Ms. Marie Nager, am I pronouncing that correctly?
Yeah, that's fine.
Head of Research and Communications of the International Drug Policy Consortium, Dr. Marta Pinto, Assistant Professor in the University of Porto, and Dr. Cassia Malonwaska. Cassia, you can correct me on that. Programme Director of Drug Policy Open Society Foundations. My Dublin dialect often doesn't allow me to wrap my mouth around particular pronunciation, so apologies.
No worries.
I invite Dr. Baptiste to give his opening statement. Dr. Baptiste, I know that you have to leave early, and that Beatrix will take over from you in relation to questions, but what we might do, we might have your presentation first, and because you have to leave at 10, we might just check if anyone in the room has any direct questions for you before we move on to other witnesses, before you have to leave the call, and then obviously Beatrix can step in then for the rest of the meeting for any further questions. So I invite you to give your opening statement. Thank you.
Good morning, and thank you, Chair. Thank you all for your availability and your time. The Chair of the committee here today on the issue of drugs is a well-known friend of the Unite Parliamentarians Network for Global Health that I represent, and a member of our network, and I'm very honored to have been invited to speak on behalf of the Unite in front of this committee. My name is Ricardo Baptiste, and I am a medical doctor trained in infectious diseases and the founder and president of the Unite Parliamentarians Network for Global Health, a non-profit, non-partisan global network of current and former members of parliaments, congresses, and senates from more than 110 countries around the world. Our network is committed to the promotion of evidence-based and sustainable policies for improved health systems, including alternative approaches to drug control for better public health and human rights and health outcomes. As myself, as a former four-term member of parliament from Portugal, but also as a physician trained in infectious diseases, the topic of decriminalisation of drug use is, of course, of paramount importance to me personally. My country has gone through major transformations over the last 25 years. If we think that in the 1990s, not that long ago, Portugal was facing a heroin epidemic where nearly 1% of the total population was either using or having a problematic use of heroin. This was actually leading to a tremendous social and economic turmoil within our societies, and no one was left aside. Every fragment of society, be it from high-income quarters of our society or from low-income parts of our society, everyone was directly or indirectly affected within the family tragedies that this represented, within the criminal impact it had in our day-to-day lives. Everyone was claiming for some form of change, that there was a need for some level of intervention to change the status quo that was leading to a disruptive moment in our communities. We were seeing families being completely destroyed and disrupted due to the problematic use of drugs. We were seeing the rise of crime related to drug use and to drug trafficking. Our communities were completely unstable due to multiple consequences of the problematic uses of drugs, and the lack of any form of response to this challenge and problem was daunting because we had no responses, be it in terms of any systemic responses or from or application of knowledge and science to address it. In reality, at the time, there were no good practices to look upon on how to address such a major societal challenge. And in the face of all of that, there was a need for legislators in the Portuguese parliament to be bold. And the legislature decided at the time that something had to happen that was different than anything that had happened before, keeping in mind that all of the prohibitionist and war on drugs-like approaches rooted in criminal punishment had all failed completely until that moment. The Portuguese members, through its the Portuguese Parliament, through its members of Parliament, decided to end prohibition of all drugs, decriminalizing the use of all drugs, and creating a model through which use of drugs was seen as a health matter. I want to highlight two very pointed points. First of all, that this was a major shift from a criminal perspective of seeing the use of drugs as a criminal issue, a judicial issue, towards being seen as a health matter. But also, it is important to note that decriminalization did not make the use of drugs legal. It merely stopped it being considered a crime, which means that it stopped getting people in jail because of the use of drugs. People would not be able to be put in jail because they were using drugs, although it would be considered, although drug trafficking naturally would be continue to be considered a crime, and that, yes, could lead to imprisonment. But the use of drugs for personal use was in no way considered a crime, and so it was not legal, but it was not a crime. And this decriminalization model has placed drug use within a 5-pillar model of prevention, drug use dissuasion, harm reduction, treatment, and reintegration. Treating drug use as a health matter has meant looking at each citizen individually, trying to understand the problematic use of drugs from an addiction and dependence perspective, and making sure that the health system was there to support people who wanted to step away from the problematic use of drugs. A very important component of this shift was understanding the need for a community-based approach, that putting people's health front and center means providing health services to all of those who need it within the environment in which they feel safe. And I want to emphasize the need to make sure that we create a safe environment to address those in need, because that's where the role of non-governmental organizations and community-based organizations are so important, because we know that formal health systems do sometimes push away people in need, people in most vulnerable situations that need support, but sometimes are afraid to go to the formal institutions to where they could find that support today. We needed to look beyond our formal health system, therefore, and reinforce the role of these NGOs and CBOs, community-based organizations, not only as providers of crucial harm reduction services, but also as entry points to broader health and social care services. While ensuring that the health system was able to provide adequate support, including treatment and rehabilitation services for those willing to participate, community outreach and involvement was necessary for services to better reach the most marginalized and vulnerable populations. After the law changed, we saw a drop of the number of HIV-related infections related to drug use. Back in the 1990s, and I come from infectious disease, and a lot of my work was with dealing with people living with HIV. Back in the 1990s, more than 50% of new infections new HIV infections were related to drug use. Today, 20 plus years later, since we decriminalized drug use, we're talking about less than 2% of new infections are related to drug use. We went from over 50% to less than 2% today. Over the last 20 years, we saw major transformations, a drop of the number of crimes related to drugs. There is no one in jail and in prison related to the use of drugs, although trafficking is still a criminal offense. And we talk about HIV infections, but I would like to highlight that all bloodborne infections, including, for example, viral hepatitis C, are typically transmitted through shared syringes, and through the harm reduction services provided and through this decriminalization approach, we can use HIV infections as a proxy to understand that all of these infections related to drug use have dropped. Many feared that Portugal would become a drug haven with decriminalization. But what in reality we have seen 20 plus years later is that there is no drug tourism, as many had anticipated would happen, and that the consumption of all drugs in Portugal has consistently stayed below the European Union average when comparing to the other countries. And so there have been a rise of certain drug tendencies, but Portugal has stayed below the European Union average, despite the decriminalization of drugs. One would expect that if those who were against the law had been right, today the consumption of all drugs would be much higher than in the European Union. We see exactly the opposite, by having a health-focused approach and not a criminal approach. I want to highlight, though, as a cautionary note, that no one policy or program can be copy-paste to another country. But there are certainly lessons to be learned that can be adapted from each context and each country to others. And Portugal's decriminalization approach was one that was successful because of the five-pillar approach, which included proactive engagement with community-based organizations, of making sure that harm reduction services, syringe exchange programs, low-threshold methadone programs, and so forth, and also social programs, including job inclusion programs, were all integrated. Without that integrated view, decriminalizing drugs alone may not be enough in any country. It has to be seen from a holistic perspective. And so to end, in my view, I would say that the main takeaway is that the prohibitionist approach failed, that the criminal approach failed, and that health and human rights-centric approach, focusing on each person, on their individuality and dignity, is much more impactful towards providing a society where people who are in need get the help they need, but also making sure that the turmoils related to the problematic use of drugs are overcome. We know that decriminalization works. We know that putting people in prison because they are using drugs does not work. But we know that decriminalization is only part of the solution. Our approaches need to be truly human-centric. They need to include all of the different components that will address the issues related to the problematic use of drugs. And we need to make sure that we are not perpetrating harm, but serving the well-being of communities and societies at large. I thank you for your attention, and I'm happy to take any questions.
Thank you, Ricardo. I think because you only do have 10 minutes, I might just ask each speaker if they do have one particular question that they want to put to you. And if we don't get to do that, we won't set the time on the clock, but just to remind members that Ricardo's colleague, Beatrix, when it comes to the official round of questioning, can answer questions on the statement. So I suppose it's just if there's a very particular question. Deputy Stanton, do you have a question you'd like to ask?
Thanks very much, and I want to thank the doctor for being with us this morning and for your work. I visited Portugal in 2015 with a delegation from here, and I was highly impressed with what we saw at the time. We met Dr. Joe Agualo. I'm not sure if he was the director of PsyCAD at the time, and Nadia Simeoz as well. They were very impressed, and a lot of other people too. Could I just ask you one or two questions? With respect to the decriminalisation, as you describe it and as you've seen in Portugal, the sale of drugs is still illegal and is a criminal offence. As you say, we call it trafficking, I think, in your here. So that means that the criminal gangs are still operating and are still providing the substances that we speak about across the board. So what you're doing here is, am I right in saying, is that you're coming at this from an individual human rights health perspective to the individual user or patient, if we move into the health area. So that's just one question. The second question is, it's been said that people have gone to Lisbon and they have been offered drugs on the streets, that people have approached them on the streets, and it seemed to be quite prolific, in fact. Now, I asked a question when I was there because it happened to me as well when I was out there, and I was told by the police they're not actually drugs at all, they're other substances. From your point of view, I'd like to know what is the situation with respect to that? Because it does actually seem to imply that decriminalisation is in some way making it more liberal. If it's available on the streets in broad daylight, people approaching tourists and others and visitors. So that's just two brief questions. Thank you.
I might take a couple of questions actually from the floor, Ricardo, just so you can respond to them all at once. Mark Ward is up next, so if maybe you can just share the question between you just so I can get around. Yeah?
Let Tommy in there.
Okay.
Yeah, just one question. Like, decriminalisation doesn't solve the drug problem or the drug crisis or drug trafficking. What decriminalisation does is it helps the individual, stop them from going to prison, and if the proper community supports are there, helps them hopefully progress off drugs or have a better quality of life. Is that fair to say?
Okay, Senator Fitzpatrick.
Yeah, thank you very much, Dr. Ricardo. If all drugs have been decriminalised in Portugal, at what point is the intervention then to diversion with the individual to provide them with support? And you've listed the incidence of Hep C and HIV. Is there any monitoring of mental health behaviour or trends since the decriminalisation? There are my two questions. Thank you.
Thank you. Deputy Horgan.
Thank you and welcome. Just two quick questions from me. One is, how important do you feel the community aspect of service provision is, as opposed to a more centralised version, a community-led version? And then I presume yourselves are like ourselves, is that whenever there is a change in legislation, you look to the next change, and I'd be interested to know what you believe Portugal's next step on its journey will be.
And Deputy McNamara, do you?
Yeah, maybe just time for a follow-up, but if there isn't, go ahead.
Okay, well, I think it may be, and I'll forgo any questions. I'll forgo any questions in this round, and Ricardo's colleague is there, so she will come back in on the official round of questions, so we will get to any other answers. Thank you, Ricardo.
Oh, thank you, Honourables, for the questions, and I'll try to be brief, as I know our time is limited, but also trying to address very important questions that have been raised. And yes, João Golão is still the drug czar in Portugal. He has been leading this effort over the last decades and has been active in this space and a very great point of contact, I would say, if you want additional, more technical information from the government on this aspect. Answering the question, is the sale of drugs illegal? Yes, I call it drug trafficking, and it is a criminal offense, and it can get people into jail. And yes, the fact that drugs are not legal allows for drugs to be sold in the black market, if you will, leading to products being sold with no oversight. We don't know what people are buying. It does facilitate the gangs and illegal movements related to that. So organized crime can be put together around these products. And that raises another issue that is not related directly to decriminalization, but is how do we address that additional challenge? Because then I'm connecting this to the other question of, is it fair to say that decriminalization is mainly focused on a health perspective, on improving the quality of life of the individual and the quality of life, if you will, and well-being of a society and a community? And I would say, yes, decriminalization is mainly focused from shifting away from that criminal approach to a human-centric approach. It doesn't focus exclusively on the individual in the sense that as soon as you are lowering tremendously the number of people who are having some level of problematic use of drugs, that has a reflection in the communities and societies at large. But the criminal aspect related to the trafficking and selling of drugs does continue. To address that, we will have to have a more in-depth conversation. I'll get to that in the last question about next steps. It was asked also regarding drugs being offered in the street, and that is a reality in many capital cities across the world, as we know. In Portugal, in certain parts of Lisbon or Porto, for example, this kind of phenomenon happens. Many times the products being sold are actually fake drugs, simulating products so it's a scam in reality, and that's a phenomenon that's been rising. We're also seeing a new phenomena with psychedelic drugs of other nature, synthetic drugs that are reaching into the European market, and Portugal, of course, is no exception. What I want to say about that is that there is a need for us to continuously work towards community building awareness on these issues, but also the police enforcement component is important. And this is all, I would say, a lesson learned 20 plus years since we have decriminalized drug use in Portugal. The first generation of police force, of police officers that were trained for this new law back in the early 2000s, they were highly committed. They were a critical factor of making sure that this transformation in society and in law actually was enacted in our communities. The truth is, ever since, new generations of police officers have come into the force who did not go through that process, who did not go through that time where the problematic use of drugs was related to so many of the health issues that we know, that they inherited a situation where the decriminalization of drug use is the norm. And we've seen that the comprehensive, compassionate approach that the first generation of police force that were engaging with people who were using drugs, that knew how to deal with this balance between the criminal offense of drug selling and the compassionate, human-centric approach to dealing with people who are using drugs, is missing. And there is a need to continue training, I would say, for the police force. There is need to invest more in making sure that the different entities involved in making sure that this system is effective, it needs to continue to happen. And so you cannot live based on your past merits, but you have to actually make sure that this is an ongoing process, and every generation has to make sure that you adapt the situation to the reality in which you're in, and you make sure that you continue training all of the different components of the system. The question was then, how do you provide support? And also this connects to the question of how important is the community-based initiatives versus the more centralized approach. From our perspective, what we have seen is that community-based organizations are much better equipped to reach out to these populations that classically have been called hard to reach. Those that live in most vulnerable situations, many times, this also includes migrant populations and so forth. Many of them, for many reasons, are afraid to reach out to formal institutions. Others are unaware of how to reach out to formal institutions. So having these community-based organizations that actually go into the city, that go into different parts of the city, that have organized services, multidisciplinary services, which include mental health and psychology services, these are critical to support people and engaging them, creating a pathway to access to rehabilitation services, but also to social services. Doing that in a centralized manner, I don't believe will be as effective in reaching all of those that actually need the support they need. And that is a reality that we see in Portugal, but also through the United Parliamentarians Network, we see this across the globe in reality. And so you may have centralized directions and guidelines, but it is important to have a very local tailored approach and involving also the municipalities and local interventions to be fully effective. And I was asked about the mental health monitoring. I can say that the process for ensuring that people get the help they need involves identifying people who are using drugs. We have what we call the drug dissuasion committees to where people can be directed to, which include typically people with mental health training. That includes sociologists and so forth, and also through the community-based organizations, ensuring that people get the kind of services they need. So the first goal is, for example, someone who has an opioid, problematic use of opioid drugs, they can be put on a program, be it a low threshold methadone program or some other, that will get them into becoming functional members of society, but also then to make sure that you create a sustainable solution, finding social responses to their needs. So, for example, if they have a family, how are they being provided for? Do they have a job? Are they able to have consistency in their job? Do they have a residence? Do they have an address that they can share in a job application? So these are all issues that interconnect with making sure that people stay on the program and eventually, hopefully, become free from it. And so these programs have been highly effective, and that reflects to the mental health issue in the sense that they become functioning members of society, they get jobs, they become contributing members of their communities. There are challenges. There are people that have been for decades on low-threshold methadone programs. That is not what the scientific evidence says should be happening. We should find ways to more proactively get people to move from being on these programs towards being fully autonomous. But this is a step-by-step process where we all have to learn, we all have to grow. To end, just to speak about next steps, I personally believe that the idea of a criminal approach to drugs since the 1960s and 70s has proven to be an absolute failure. And so going beyond the decriminalization to start the serious discussion of how do we address the legalization of drugs in putting them within a state-regulated program, not full-fledged legal liberalization of the drug market, but actually having a highly regulated market, starting off with cannabis, for example, is something that is in the pipeline in the Portuguese discussions. And this would, and if you have been approached in Portugal, for example, with someone selling drugs on the street, many times it's cannabis or cannabis-related products. This would kill more than 50% of the drug trafficking across the globe if we were to be able to find a regulated way to approach the cannabis market. And that would be a huge dent in the drug trafficking gangs and illegal activities. And it's money that would be in the state's coffers that would be able then to be used for safety, security enforcement, that could be used for health services, it could be used for harm reduction services, it could be used to make us more effective at making sure that the state is doing its job of creating societies that are safe for our children and for future generations. And so I believe that that is a serious discussion that should be embedded in this more specific conversation around decriminalization. Thank you.
Thank you. Thank you, Dr. Ricardo, and thank you for your time this morning. And we look forward to continuing conversations with Beatrix in your absence, and much appreciated. I'm now going to move on to the other witnesses. And unlike what just happened there, we'll hear from the three witnesses one after the other, and then we'll go into questions from the members. So next up is Ms. Marie, Head of Research and Communications of the International Drug Policy Consortium.
Thank you very much, and thanks for giving me the floor for the invitation today. So my name is Marie Nugier, I'm the Head of Communications at IDPC. So for those who don't know us, IDPC is a global network of NGOs that come together to promote drug policies that are grounded in social justice and human rights. So in 2023, IDPC produced a shadow report that was directed at the United Nations Commission on Narcotic Drugs, and it basically reviewed progress made in global drug policy since 2019. And the conclusion that we reached was very clear. Punitive drug policies have by no means reduced the scale of the illegal drug market. They have instead resulted in a major public health crisis, which is claiming an estimated 500,000 drug-related deaths every year. And we know that these deaths are preventable. Criminalization and punishment have also resulted in a severe prison crisis, with 1 in 5 people incarcerated globally for a drug offense. Recently, the Office of the High Commissioner for Human Rights and the UN Special Rapporteur on the Right to Health have both released seminal reports which highlight the devastating impacts of punitive drug policies on human rights. And that includes the denial of access to essential medicines, of harm reduction and treatment services. It includes arbitrary arrests and detention, police violence, and multiple cases of discrimination on the basis of race, gender, and class. Importantly, the High Commissioner and the Special Rapporteur both reached the conclusion that governments should urgently consider decriminalisation and responsible regulation of all drugs. And IDPC's research has also shown the potential of both policies if they are done right. So first, let me say a few words about decriminalisation. So today, when you look at what's happening around the world, around 66 jurisdictions in 40 countries have adopted some form of decriminalisation. But basically what we've also seen is that there's as many models of decriminalisation as there are jurisdictions that have decriminalised. So as Ricardo said earlier, no policy can be copied and pasted somewhere else. But there are key lessons that we can draw from what has and hasn't really worked, and we can draw a set of principles from that. And that's what we've done at IDPC. Based on the evidence of what's been happening around the world, we've developed a gold standard of decriminalisation. So I'd like to present 6 of the principles that we came up with in terms of what would work best in a decriminalised environment. So the first principle is that decriminalisation is most effective when it covers all drugs and focuses on all activities associated with drug use. So not necessarily just drug use and possession, but it also should cover cultivation for personal use, social sharing, possession of drug use paraphernalia. Secondly, decriminalisation should entail the removal of all sanctions, both criminal and administrative. So that's the conclusion we've reached, because any sort of punishment can negatively impact people's lives, especially those most marginalized. And the objective here should really be to reduce any sort of contact with the police and the criminal legal system. And that's why we're calling for full decriminalisation. 3, decriminalisation should be paired with the scaling up and funding of systems of care and support for people who use drugs. And there, the Portuguese example is particularly important in that regard, because that's what happened there. 4, decriminalisation should include the expungement of previous convictions for activities that are now decriminalised. 5, and that's something that's important. So basically, we've seen that in some instances, decriminalisation exists on paper, but it's actually not properly implemented on the ground. So very often, a decriminalisation policy will require significant training of responsible authorities to make sure that it actually materializes on the ground. And in addition to that, to avoid any possible backlash against the reform, it's very important that decriminalisation is accompanied with awareness-raising campaigns amongst the general public. Finally, and very importantly, people who use drugs have to be involved in all stages of the design, the implementation, the monitoring, and implementation of decriminalisation policies. And that's to ensure that the decriminalisation policy doesn't have any negative unintended consequence, and also because people who use drugs know best what's right for their community. So now, if we decriminalise all drugs, why should we discuss legal regulation? And conversely, if we legally regulate certain substances like cannabis, why should we even consider decriminalisation? So I'm going to address both of these points before I finish my statement. So legally regulating at least certain drugs in countries that have already decriminalised drugs is critical. And this is because decriminalisation policies focus exclusively on activities relating to drug use, but they do not focus on the supply side of the illegal drug market. And so as a result, people who use drugs continue to rely on an unknown and sometimes highly toxic drug supply with all the possible harms that are associated with it. So legal regulation would enable public authorities to actually establish clear rules on the quality, the composition of the substance, on access, on pricing, on where it's possible to consume, et cetera, et cetera. At the same time, regulating the market means that a conversation is now possible on how to address the multiple layers of oppression, of violence, vulnerability, and exclusion that are faced by many of those who are involved in illegal drug supply. And that's not possible in an environment that is just decriminalized. And finally, regulation would help to reduce the huge burden that drug control has placed on the criminal legal system. So now, why discuss decriminalization if, say, a country has already legally regulated cannabis or another substance? Well, this is because even if cannabis or any other substance is now legal, many activities will inevitably continue to operate within the illegal drug market. So this includes activities related to the cultivation, production, trade, and use of other substances that are not yet regulated. But even for substances that are regulated, so for example, cannabis, there will still be activities within the cannabis market that will operate outside of the legal market. And so for these, it's absolutely critical that drug use and related activities are decriminalized for all the reasons that I've already mentioned. So decriminalization and legal regulation are complementary policies, both with advantages and limitations. And so that's why I hope that both can be considered in drug policy discussions within Ireland. And it's important to note as well that as for decriminalization, regulatory models vary considerably from one another. And that means that it's perfectly possible to avoid the risks that can be associated with highly commercialized models of regulation, because that is one policy option, or one regulatory option. There are many more. So I'm happy to further elaborate on this, but for the sake of time, I'm going to stop here, and I look forward to your questions and comments. Thank you so much for your attention.
Thank you, Ms. Nougier. I'm going to move on now to Dr. Marta Pinto, please. You're on mute.
I'm very sorry. Can you hear me now?
We can.
Okay, great. Thank you very much. Thank you, Chair. Thank you for the invitation to be here. It's really an honor for me. I am a professor of psychology of justice in the University of Porto and a board member of the European Society for Social Drug Research. And I've been working in the field of drug use for 28 years now, combining academic activities with clinical and outreach intervention. This statement is therefore informed not only by my scientific knowledge, but also by my experience as a psychologist and a citizen in a country which, as Ricardo said, has radically improved its drug-related profile in the last 2 decades. Before the reform, the country had one of the worst scenarios in Europe in terms of drug-related problems. We faced a high prevalence of problematic drug use, high rates of drug-induced deaths, overcrowded prisons because of drug-related crimes, high prevalence of drug-related infections like HIV, viral hepatitis, and tuberculosis, and drug use was classified by the population as one of the 3 most disturbing phenomena to face. Well, the Portuguese reform, came in 2000. Portugal decriminalized, as we already discussed, the simple possession of all types of drugs. And drug use was defined as a healthcare issue, while drug trafficking has remained a topic for the criminal justice system. The commissions for the drug dissuasion of drug addiction and not drug use, I would like to highlight, were created and adopted a comprehensive approach aiming to dissuade drug abuse and its related harms. Using drugs is still prohibited, as Ricardo said, and may be sanctioned with administrative measures like fees, community services, and so on. Those commissions can also do the referral for treatment. But the reform went far beyond the decriminalization, and that I would like that could be clear here in my presentation. Harm reduction was legally allowed in 2001, including services like low-threshold methadone programs, needle exchange programs, and drug consumption rooms, for example. But besides that, there was a considerable renewal in the political and financial investment. The network of specialized services was expanded, as well as the funding for research. And there was also the creation of an interministerial organism, IDT at that time. So efforts were made to offer good coverage and accessibility of harm reduction, treatment, and reinsertion programs of multiple types, and a highly complex and territorial strategy that tries to address, in an integrated and humanistic format, all the needs of people who use psychoactive substances, as well as their families and communities. With the reform, the Portuguese scenario, as I said, changed dramatically. There was a discrete growth in illicit drug use among adults, that's true. But, for example, the EMCDDA itself said in 2011 that Portugal's drug situation is characterized by a level of drug use in the general population that is, on the whole, below the European average and much lower than its only European neighbor, Spain. What makes the Portuguese case special is that decriminalisation was not, as in other countries, associated with an increasing prevalence of cannabis use among young people. So there was a decrease of illicit drug use among adolescents, in prevalence of ejected drug use, in blood-borne infections, in stigmatization of people drugs, and of the weight represented by people who use drugs in the judicial system. To reinforce what Marie Nugier was saying, I did, with my team, a scoping review in 2020, and in that literature review of 69 scientific articles that address decriminalisation policies, we found that they do not seem to result in a significant increase of drug use prevalence, nor in greater markets, larger supplies, or lower prices. They tend to save money on law enforcement and on criminal justice system. They seem to decrease drug-related crimes. They are associated with an increase of arrest rates for selling and trafficking. They are associated to reduced incidence and prevalence rates for infectious diseases and increased numbers of people undergoing treatment. And they are associated, and this is important also, with an increased support from the public opinion for decriminalisation, as people tend to become supportive of a legislation that does not criminally persecute people who use drugs, but redirects them to health and social care. So, to conclude, I would say that Portugal has had a very, very good performance in all the usual indicators to evaluate drug policy, but decriminalisation alone would most probably not be capable of producing those effects. So I reinforce what has been said until now in this meeting. And recent policy innovations have been showing us consistently that the potential of more humanistic, comprehensive, user-friendly, and ethical interventions, although sometimes have a great potential, and although sometimes they look counterintuitive, like making syringes or drug consumption rooms available to people who use drugs, those seem to be more effective than the punitive approaches that we used before. So thank you very much for your time and your attention. I look forward for discussing these topics with you.
Thank you, Dr. Pinto. And now finally, I move on to Dr. Kasia Malinowska-Sempruk. Thank you.
Thank you very much. That was almost perfect pronunciation, so maybe you have Polish blood in you. So I work for Open Society Foundations, and we are supporting efforts that are sort of rethinking drug policy across the globe. And since this is an international panel, I will share some of those experiences. But let me just start by saying that even though we see drug use as a public health issue, legally it continues to constitute a criminal offense. And it constitutes a criminal offense that law enforcement pursues quite vigorously. Not equally vigorously in every country of the world, but this is often where police enforcement, for example, makes its overtime. And so I think this needs to be acknowledged in some way. From a human rights perspective, criminalization of drugs is problematic because it infringes on people's right to autonomy and basically and privacy of private behavior. But criminalization is even more inappropriate in a context of the overdose crisis that the world is experiencing right now. And it is essential that people who use drugs actually feel safe contacting the authorities to seek help, report on overdose, alert them to dangerous batches of drugs, and all of that becomes highly difficult when a person is criminalized. And I think this is what we've heard from and what Portugal has taught us over and over again, that at the time when drugs were decriminalized, actually people were more ready to access services, and that with decreased number of people in prison and criminal charges, the number of people willing to go into treatment and engage with public authorities actually has grown impressively. And so I think particularly at the time of overdose crisis and adulterated powerful synthetic opioids, we should be aiming for that increase of people in treatment, voluntary increase of people in treatment. And so I, for example, recall when China, I was visiting China when China was rolling out its methadone programs. And actually they were experiencing a different phenomenon. Their methadone programs were at 30% capacity. And I had conversation with officials that were responsible for those programs and with drug users. And the story was actually very simple. Public health officials were concerned that even though services are available, people are not using them. And drug-using people told us, why would I self-identify as a drug user? If, around the corner, there could be a police official, a police person that arrests me going into the program or leaving the program, because drug use is a criminal offense in my country. So that connection was actually made quite clear to me when I had those visits and conversations in China. In the US, where I live, women are extremely reluctant to walk into harm reduction services because, again, self-identifying as a drug user runs multiple risks for them. For example, a very real one, their children could be taken away if they're charged with drug possession. At the same time, I actually, when I visited Switzerland, Zurich, also a number of years ago, and was actually talking to police officers, it was the police officer in Zurich that took me to heroin maintenance program, which was not on my agenda, because I didn't want to feel, like I'm a voyeur of people's drug use. And he took me to the heroin maintenance program and said, listen, you have to see this, because this public health helped us solve heroin trafficking program in Zurich, because people who used most heroin were the ones that were most dependent on heroin. So 80% of illicit heroin was used by those that were most dependent. And so he said, we naturally decreased number of trafficked heroin into Zurich because we opened heroin maintenance program. And that was a story that was shared with me, and data on this was shared with me by police officers in Zurich. So as long as drug use is a criminal offense, the threat of arrest or criminal charges will continue to hang over the heads of people who use drugs and push them away from health and social services that can actually save their lives, particularly now in the overdose epidemic. Research has repeatedly found that criminalization of drug users makes people who use drugs less likely to seek treatment or other health services, or to report a suspected overdose. Decriminalizing personal possession for personal use be an important step toward creating trust between communities, something that we've talked about, law enforcement, health authorities, and it is essential to addressing the health harms of drug use and reducing overdose deaths. And we know that decriminalization works. In 1990s, Switzerland, faced with major problem with illicit drugs and growing HIV epidemic, instead of doubling down on criminal justice response, decriminalized drug use, expanded harm reduction, and opened safe injection sites. Today, Switzerland has among the lowest levels of drug-related deaths and new HIV infections in Europe. And of course, we've heard repeatedly about similar experience of Portugal. So increased availability of naloxone, Good Samaritan laws, and greater access to drug and other medical treatment are all very, very important. And they are all key parts of rights-based response to overdose crisis. But decriminalization of drug possession for personal use must lie at the heart of that response. Thank you.
Thank you, Cassia. I'm going to move on to members now, and first up is Deputy Stanton, and then after Deputy Stanton's engagement, I've swapped myself out as I'm currently in the chair, and Deputy McNamara, you will be after Deputy Stanton then. Thank you.
Thanks very much, and thanks for your presentations and for the work you're doing in this area. Number of questions arise here. First of all, why is the use of certain drugs criminalised? I understand that the Marijuana Tax Act in 1937 criminalised cannabis at federal level in the United States. So is it the case that these drugs are criminalised to protect people from being harmed by substances? Is that the reason? But from what we all know, it's not working because people are being harmed anyway. But I'm just wondering, you know, when we go back as to the genesis of criminalisation, why it happened, when it happened in various jurisdictions. So that's just one question. The second question then is, when we talk about decriminalisation and dealing or trafficking, how do you draw the line between the two? Now, we had this question again last week. And I know in the past in Portugal, they had a scale of weights of various drugs, and if you went over that weight, then you were deemed to be a dealer. We were told last week that's no longer the case, that it's now a far more fluid mechanism for distinguishing the issue between decriminalisation and or personal use, and dealing. The final question has to do with regulation. Now, we regulate prescription drugs for very good reasons, because if people take them that shouldn't take them, they can cause harm. And also, we regulate them because some of these are quite scarce, as we know at the moment, and you know, they're expensive, and they should be targeted at people who really need them. But I asked the question last week as to if we were to go down the road of to regulate drug use, how would people see that working with respect to where would people buy them, who would supply the retailers, and how would that mechanism work? Or would you be in favour of kind of going down that route? So they're just the three questions. Why is drug use a criminal offence at the moment? How can you draw a line between personal use and dealing, and trafficking, and then the regulation of the whole issue, and bring it out into a more legalised methodology?
Is there anyone particular you'd like to answer first?
Well,
or
I mean, no,
open?
not really. So I didn't.
Okay.
Yeah.
Okay. So whoever wants to come in.
I'm happy to come in first, if that's okay.
Yeah.
So let me offer the following. I'm speaking to you somewhat awkwardly, and I apologize for that, from a hotel room in Geneva, because I was just in a meeting of the Global Commission on Drug Policy, and what I think what I'm free to share is that, you know, the incredible frustration former presidents and sort of high level individuals have shared at the failure of the drug control system, because if you look at the data in terms of, are people using less drugs, more drugs, it's clear that people are using more drugs today than ever before. So whatever it is that we're doing using the criminal justice approach is simply not working, right? So it's not working, and it also is producing incredible violence. It's producing corruption. And so we sort of have put in place a system that had good intentions. So I think the question that you're asking, why drugs were criminalized, because we tried an approach and we hoped that criminalization is going to actually deter people from use. And we now have learned that it's not working. So, is there anything wrong with trying an approach? Okay, that's what the world chose to do as the first response, as the first idea. But it's now decades later, and we continue to do the same thing. And so the intention was that this will deter. It doesn't. So let's just change that approach. And so what I wanted to share, because it actually spoke quite clearly to me, is that we criminalize drugs, and people who are recipients of that approach are petty sellers and drug users. We are not. So these are the people on the bottom of the pyramid. And we do nothing to actually get on the top of that pyramid. And this is where, which is the drug cartels, which people who are incredibly powerful, who are incredibly financially powerful. And so at the top of that pyramid is where violence is generated, is where corruption is generated, and we have completely failed to address this issue. And so I think it's time to say, we're doing it incredibly incompetently, even though our intentions were good. And so I think there's really enough data to say that criminalization has not worked. Let's take a different approach. So I will stop here, because again, from the global perspective, it's not only that the drug policy and drug control is not effective, it is in fact harmful if you look at all the harms it creates at the global and local level, including the overdose epidemic. There is a reason why beer was not popular during Prohibition. Because you would not want to risk the punishment, having huge barrels of beer. People actually only made incredibly powerful alcohol. And this is what happens with drugs today. We have basically incentivized drug traffic organizations to create powerful, dangerous drugs. And so the system is incredibly ineffective and incredibly harmful, and it's time for a change. And the only the way that change can happen is actually for countries to be brave and to take care of their citizens in the way that they deserve to be taken care of.
Thank you, Cassia. We've gone slightly over time, so if Marie can be maybe brief in her response, and then if Ms. Pinto maybe can come in maybe on the next round if she has something that she wants to come back on, but we'll move on to Mr. McNamara next after Marie. Thank you.
Thank you so much. So I will try to be brief, and so I'll address the other two questions that haven't been addressed by Kasia yet. So in terms of drawing the line between use, dealing, and trafficking, there are various ways of doing this. In practice, a lot of governments have used threshold quantities to define, okay, this is the minimum or the maximum amount of drugs that you have at your disposal. If you are beyond that, then you're going to be a dealer. If you're under it, then you'll be considered as a consumer. The very important thing about threshold quantities is two things. So first of all, they need to reflect the realities of the market, because if the threshold quantities are too low, then you're ending up criminalizing more people who use drugs than before the reform. So that's what happened, for example, in Mexico or in Russia, where Russia has decriminalized, but they have such low threshold quantities that it's basically a useless system. The second thing is, there again, you need to have the engagement of people who use drugs, and the threshold quantities need to be flexible because, for example, a lot of people, for example, at times of COVID, were buying more drugs because they didn't want to, they could not go out that much, or they don't want to have that many interactions with the police, right? So you need to, or they would buy for their friends or other people, so as a social sharing approach. So you need to be very flexible in terms of the threshold quantities. Other things that you can consider is, for example, use a case-by-case basis. So, for example, is the person attending harm reduction services regularly? Like there are a number of factors that you can use. In terms of our kind of gold standard, we usually recommend flexible threshold quantities where people are able to also identify other factors, because threshold quantities, as I said, are problematic in some ways. In terms of regulation, I mean, we can talk about this for hours, I think. So I'm not going to go into tons of details, but there are many mechanisms that we can use for this. So Kasia has already mentioned the heroin-assisted treatment in Switzerland. That's a model of regulation. And that's a model that enables people who are sometimes extremely marginalized and highly dependent on heroin to access a safe supply of heroin. And that's an approach that's worked incredibly well. I mean, all of the trials, the trials that have been, or research that have been made on heroin-assisted therapy have shown the benefits of this approach. For coca, there are some mechanisms, for example, in Latin America that shows that coca is actually not harmful as a substance. It can be sold as tea, it can be sold as leaves, or as powder, and this can be just sold with very minimum levels of regulation in shops.
Sorry, Ms. Uge, I'm going to have to interrupt you, and if maybe you can come back in maybe later on those points. I think the regulation one is such a big question that maybe in the second round, Deputy Stanton maybe wants to focus particularly on the regulation piece, if that's okay. Deputy McNamara.
So thanks very much. No, I mean, I'd maybe like to give you the opportunity to come back in now, because I do find it interesting. I mean, is it fair to say from most of the speakers that you're, or at least maybe Ms. or Dr. Malinowska-Simpruch was maybe less emphatic, but that the preference is to move towards a legalisation and regulation model, to go beyond decriminalisation, and if so, what would it look like? I mean, do I understand correctly that the hope in doing so would be obviously that you regulate the substances and in terms of toxins that may or may not be added in terms of strengths, etc., so that, you know, to make overdosing and the worst effects of drug use less likely. But to do so, and I suppose it has the added benefit of taking criminal gangs out of the equation. However, is that, from the limited knowledge that we have of countries that have legalised, now we haven't heard from witnesses in that regard yet as a committee. We're hoping to, and despite our best efforts, we haven't managed to hear from people yet. But in countries where some degree of legalisation has been has occurred, is that the experience, or are criminal gangs still operating in tandem with more legal sources? You know, just because the sale of tobacco products is legal and regulated in Ireland, as most countries, but there's still a thriving black market in it. There's still a relatively small, well, I think it's relatively small anyway, market in selling alcohol on the black market, even though, you know, we have a fairly large legal alcohol sector in Ireland. So that's my questions.
Thank you. Ms. Nugent, do you want to come in there to finish what you were saying in relation then to regulation, and then obviously the other questions?
Yeah, fine. I think that's a very good question, because obviously one of the key advantages of legal regulation is to take the market back into the hands of governments and make sure that organized crime no longer operates within these markets. I mean, I think we have to be realistic. Legal regulation will not end all illegal activities, and that's very clear. Criminal gangs will continue to operate. It just depends on the level of regulation that we put together. And it's a matter of balance. It's also a matter of adapting to the realities of each country. So, for example, in the United States, you had these huge markets already operating fairly legally with medicinal cannabis. And so then the medicinal cannabis market that was legal then kind of got converted into a legalized market for recreational drugs. So in these markets, actually, organized crime was not that prominent because most of the market was already legal. In countries like Uruguay, for example, there has been a fairly big proportion of the market that has been withdrawn from organized crime. However, some of the markets remains illegal because the level of restrictions on the market were so strong that actually it didn't manage to counterbalance the entirety of the illegal market. So I think we need to be very careful, and it's a learning process. Like, it's new. I think we need to be very mindful that there will be some trial and error there. The idea is to make sure that we retain as much as the market in the legal environment, and that will require some adaptation to make sure that, for example, the pricing is not too high, because otherwise people will continue to go into the illegal drug market if the price is lower. Or that people who have been traditionally cultivating cannabis, for example, in the illegal environment, have a chance to continue cultivating in the legal environment. So making that transition and having a social justice approach to legal regulation will be incredibly important to make sure that we counter organized crime. So I'm going to end here. I don't know if Kasia or Marta or Beatrice have other elements they want to add.
So maybe the only piece that I would add on regulated market is that obviously it needs to be really well thought through, and that the assumption that we should all make is that handing it over to large, for example, cannabis business is not the smartest idea. And that, for example, people that have been most impacted by criminalization actually can find work in that market. So you will see a lot of efforts in the United States where small dispensaries that hire people who, for example, had criminal records are creating job opportunities for folks who otherwise would continue to be disfranchised. I myself was a little surprised when I was in Massachusetts that if I wanted to order cannabis delivered to my hotel, the person that would bring it to me is someone who was in prison for cannabis crimes. And that was a way to include folks who actually would likely end up on the fringes and continue acting in ways that were illicit, because it was incredibly difficult for them to find work. So I think what you would benefit from is actually a lot of thoughtful efforts. If that's what you chose to do, regulate cannabis in the future, you would benefit from a lot of thoughtful efforts on how to do it, to actually do it in a way that is most effective and that brings communities affected and has them benefit from that process, and as a result, limits their engagement in further illicit activity.
And then Ms. Pinto.
Yeah, thank you. Well, I would just like to show that I agree totally with Marie Lugier and Kasia Marlinowska about this, and I would like to highlight this last intervention of Kasia. Social justice must be taken in consideration while regulation is put in place, because we already have learned how these processes might be perverted if we don't take that in consideration. And if you allow me, I would just want to make a comment on what Deputy Stanton asked before, because I think it's important to bring this to the discussion. I will only take a minute to say that why the use of certain drugs has been criminalized. I would just like to highlight that we cannot look at the drug use problem without doing the necessary contextualization in the historical and cultural background that these issues always bring with them. If we look to the history of drug use since the last decades of the 19th century, we can always see that criminalization, diabolization of the use of certain substances has much more to do with cultural and social dynamics related to the groups of people who use those substances than with the harms that they can bring, with the damages, with their pharmacological properties, and so on. Alcohol, for example, is a very dangerous substance which has not been, except for a period that we all know very well, has not been problematized as many others. And we can see there are several studies already made in this subject that show very clearly that there is a strong gap between the United Nations conventions on the substances and their classification regarding their levels of dangerousness and the classifications made by independent experts, which means that many substances that in a rational, scientific point of view are not as dangerous as they seem in the international conventions, and on the contrary also. So I would just like to bring to the discussion the importance, the relevance of taking in consideration that when we are talking about drug use, we are not only talking about the pharmacological properties of the substances, but we are dealing with complex social and psychological dynamics that in the history of prohibitionism have made the prohibitionism to act upon those in the most vulnerable situations in a very unproportionate way. So
Thank you.
I would like to take that in consideration, because if we don't do that, problems will not be solved.
Thank you, Ms. Pinto. And before I move on to the next member, I just want to note that I do apologise if I do interrupt. It's just that there's a set amount of time of 7 minutes which you won't be able to see online in relation for the members to ask questions and get answers, but I'm reluctant to obviously interrupt in responses, because obviously that's what we're here for, is responses. So I do apologise that, and obviously try and make sure that there's latitude given while making sure that every member, I suppose, gets their allotted amount of time. Deputy Ward.
Thanks, Chair. And on that note, I won't have a big preamble. I'll just go straight into questions. So, first question is to Ms. Faz, probably in Dr. Baptista's absence. When Portugal ended prohibition and moved to a decriminalisation model, is there anything that you would have done differently? Was there any unintended consequences? So we heard of unintended consequences there by a previous speaker in the States and in China. Was there anything at the very early stages that Portugal might have done different, or anything that they can learn from that we could use in an Irish context if we were to move that way? Thank you.
Again, thank you very much for the question. I won't start on the historical piece. Maybe Martha can jump in terms of what could have been done differently at the time. If you would allow me, I would pick up on a point raised earlier about what are the next steps for Portugal and what is Portugal doing currently, and highlight the example that was mentioned about recent reforms that were taken in Portugal to look at the decriminalisation system and then see how to make it more effective. That happened last year within this kind of lens that the reforms happened 20 years ago, and we have been experiencing a lot of changes in the drug market, also as a consequence of continued prohibition globally. And for example, in the 1990s, when decriminalisation was defined in Portugal, thresholds were set for the most commonly used substances that were then included under decriminalisation. They were calculated for 10 days a month for personal possession, and that fit under the decriminalisation framework. But we have seen in recent years globally is a big rise in the use of novel psychoactive substances and other synthetic drugs, which were not covered under Portuguese decriminalisation. So, for example, the dissuasion committees that we have been mentioning as a form of diversion were not available for people charged for possession of novel psychoactive substances. So the Parliament in Portugal also highlighted that this, not including these substances, has created a discrepancy, particularly that actually the most vulnerable people in society tend to be the people using these substances more, and they were exposed to more contact with the criminal justice system and more risk of arrest and sentences because of this. And they've also highlighted within the discussions of this reform, sort of the difficulties that we've discussed to some extent of distinguishing between people who use drugs and people who sell drugs, and based on the amounts that people carry for their personal possession. So it was argued that it would, during this reform process, that to determine whether people are selling drugs for bigger financial gains that actually require the attention of law enforcement, the mere possession amounts are not enough. So the decision was to remove the thresholds for possession and instead look at different ways to for the police and prosecution to prove sort of intent to supply. But again, and this point has been raised before, it's also a part of this reform and this discussion that there's a huge overlap between people who use and sell drugs, and most often the people who are, including in Portugal, who got into contact with the criminal justice.
Can I ask a question just in relation to the 10 days that you mentioned? Where did that come from? What was the scientific, what was the rationale behind the 10 days originally for possession? What was that thinking behind that?
I think Martha might be better knowledgeable about that than me, so I'm happy to hand over.
Okay, thank you.
Ms. Pinto.
Okay, thank you for the question. Thank you, Beatrix. You already said many of the things that I was going to say. Well, I think that one of the good practices in designing the policy is that there was created a commission of experts which tried to analyze all the available evidence at that time. And also they assumed a very participative format for creating the national strategy, including the auscultation of people who use drugs, their families, the communities, people working in the field, and so on. So I think those 10 days came from there, from the general auscultation of the population and of the people who use drugs, and also from the auscultation of other harm reduction and treatment and so on, responses being held in other countries. So I don't know if that answers the question, but the idea was to prevent that people, that the law had a very low threshold that would make that possible that people not selling drugs would come in contact with the criminal justice. So we know that many people need to buy the substances or choose to buy the substances for several days, for example, because they don't want to be in contact with the dealers and the traffickers very often. So they try to avoid those environments. Also because some of the people who live outside the big cities don't have access to the substances, so they have to buy for big periods of time. We also heard from Marie Nogier the example of the COVID. So some contexts make it necessary or preferable to buy doses for more than 1 day. So 10 days was the period established, and that's it, trying to give an objective measure to distinguish drug trafficking or dealing from drug using. Also, the Deputy McNamara asked what do I think that could be improved? Well, I think that there were some problems in law in practice. For example, drug consumption rooms, which have already showed in a very consistent way their value in scientific terms and considering their effectiveness. Took 20 years to exist in Portugal, although they were reviewed in the law since 2001, for example. And also, when the thresholds were set, there was a void in the law that did not review what to do when people not trafficking drugs, but having with them more than the threshold established for that substance in particular, because the law has different thresholds for different substances. And the law didn't say what should be done if the person had more than reviewed for personal use, but was not trafficking drugs. So there was a decision somewhere in the court that decided that those people must be punished. And that decision already opened the doors for future sentences of this type. Just one more thing. I would like to say that the Portuguese model has been changing over the two decades, mostly for external factors. As I said in my presentation, the support of this network of specialized services given to people who use drugs and their families is absolutely crucial to have good results. And the problem is that the financial crisis in 2008, then the austerity measures, and now the crisis that we are living in nowadays have been have had a great impact on the social and healthcare support that is given to those people. So I fear that the results will not be the same over time. So once again, I would like to highlight that decriminalisation by itself alone does not solve the problem. And just one more thing that I would love to say, 1 minute. I always use qualitative, participative approaches in my methodologies when I do my research. And I would like to bring the voices of people who use drugs that I always listen to. And one of the things they systematically say that is failing since the beginning of the reform is the reinsertion component of our interventions. People are cared about regarding their health indicators and so on, but then working to give them a sense of usefulness, of integration in society is always a secondary aspect that they would love to change, be changed.
Thank you, Ms. Pinto. And I'm going to move on now to Senator Fitzpatrick.
And thank you all for your time, and this is really helpful. My understanding is no jurisdiction in the world has decriminalised, or not decriminalised, legalised all drugs. And just correct me if I'm wrong on that. And we all, not we all, but maybe I think there is broad acceptance in Ireland that absolutely the approach of criminalisation has utterly failed. I suppose drug dealing, drug usage is undermining and damaging individuals and communities all over our country. So we're coming at it from that approach, and I think there is broad acceptance and support for a greater support and resourcing of a health-led approach. You know, elderly people, children, young adults, there's communities that are really just under siege here. And I suppose how it manifests itself is, you know, people living in parts of our capital city, they actually go in and close their door. You know, they just close their door. Elderly people can't go to the post office, can't go to the shops. They feel so intimidated and oppressed by the presence of drug dealing and drug usage. Young adults, their lives are being limited because of the intimidation, the coercion, the absolute abuse of their situations. So our big question is, how far do we go? And in making changes, we need to make them meaningful, and we need to make them successful so that we can not just promote, but actually ensure more sustainable communities. So my question is around the decriminalisation, and it's just not clear to me from your evidence, how are drugs distributed? How are they sold in a decriminalised environment? And I'm talking about all drugs. And I really want to understand how that takes place. And I suppose to actually remove the drug dealers, this street activity that we talk about, that we're all too familiar with, do we actually have to go to a full legalisation model? And is that the only way to actually remove that? Because that's a big imperative. It's a broader societal imperative, and it's one that I think, to address the individual, and to really remove the stigma and the damage and the shame, and that has to be addressed. So I'd like your views on that.
Cassia?
So I will start just with a very brief statement and hope that others can continue. In order to remove illicit market, which, as you describe, are dealers, the only way to do so is actually to regulate, for government to take the ownership of the market and to regulate. No country has regulated all drugs. What we do know at the moment is the country of Bolivia has regulated the coca production market and allows some growing. Canada, Uruguay, states in the US, and now increasingly in Europe, where governments are regulating cannabis market. Heroin is regulated by some governments like Switzerland and others, and making it available to people who are most dependent and failed in other forms of treatment. So we are in very early days of regulation, and only in those instances, people are able to buy or receive drugs from a legal market where government took responsibility for how it's being regulated. So we are in early days, but actually data from those examples is quite positive. Now, if you want to truly make sure that illicit market is gotten rid of, it's really the only way to go is to regulate. I think what we're considering what you're considering in your country right now is decrim, which is not going to get rid of illicit market. I would say that you still want to regulate in order, you want to decriminalize in order for people to access services that will let them know what substances are on the street, are they dangerous, so information can be shared, so it all comes out of the shadow and people are not afraid to engage with public health and social services.
Thank you. And Ms. Nougier?
Yeah, thank you. And just to continue on the line that Kasia was taking, I think it's absolutely correct. I think it's also a bit more acceptable for the general public to start with decriminalization, and that results in solving many, many, many issues related to drug use. But then, yes, if you want to have a model where you know where drugs are distributed, you know how they are distributed, and you can manage that, you can control that, then that means you need legal regulation. And you can start with one substance, and then you can build on that. And on that experience as well, learning from that experience, for example, if you start with cannabis, and then see how they can be adapted with more or less stringent controls on other drugs. I mean, when you look at the experience of control, in particular in Europe right now, a lot of countries are putting emphasis on cannabis social clubs, on that model. That enables the cultivation and use to be done in cooperatives, which are small, they're not for profit, and that enables people who use drugs to have contact with one another and share information. So it's also a way for them to build that level of trust with the products that they are using, but also sharing information on how to reduce the harms, the possible harms associated with their use. So that's a model, for example, that Germany is adopting, Luxembourg, Malta, and also Uruguay and others in other regions. But that could be a model that enables to remove this issue of coercion and intimidation, at least for the cannabis market. And we know that cannabis is by far the most widely used substance across Europe and in the world.
Thank you, Ms. Nougier. Does anybody else want to come in, or did you have a follow-up question, Senator?
No, that's okay.
You're okay? Okay. Oh, sorry, does Marta want to come back in? is that a... Okay,
yes,
sorry.
yes,
Yeah.
just a minute.
Yeah.
I agree with all that was said in this topic. I just would like to say once again that drug use, if we look at the history of drug use is something that makes part of the human behavior in all societies, all times. So I really don't think that we will manage to end up with drug use. On the other hand, crime, black markets, infection epidemics, and so on are much more the products of bad drug policies than of the drug use itself. So if we go for good drug policies, science-based and rational drug policies, complementing them with services that are holistic, user-friendly, and that care for the people who use drugs and their families, maybe that would be the best path to follow. And I would just like to give you a practical example of how user-friendly responses can have good results. For example, in drug consumption rooms, I've been learning that when we have a very clinical format, and make a contrast with a format that is much user-friendly, which is appropriated by the people who use drugs. What I get from the studies, for example, in the drug consumption room in Porto that I'm evaluating, is that users repeatedly say that they feel so well inside that they tend to use less drugs over time. So if we understand what they need and give them the responses that they need, we are contributing to get to what we are aiming to. Thank you very much.
Thank you, Ms. Pinto. Deputy Gould.
First of all, I want to thank you all for presenting today. It's really important and interesting and informative information that you are giving us. I have a question for maybe a comment from all of you, and that would be, we often discuss poverty as the root cause of addiction, and I wonder if anyone has a comment to make on the impact of the welfare state on the impact of poverty prevention measures and how this interacts with decriminalisation.
Anyone particularly want to answer that, or does anyone want to select themselves?
I couldn't understand the question. Could you repeat it, please?
The question is that addiction, the root cause of addiction is poverty. And like you have decriminalisation in Portugal, but at the same time, was there investment in welfare supports to, I suppose, to reduce poverty prevention, or to reduce poverty prevented? Like, so you have decriminalisation, but we also have to tackle the root cause.
Ms. Nougier is...
Thank you very much for that question. I totally agree with your point of view. I think that Portugal has made a very serious investment in trying to deal with the social disadvantages of people who use drugs. We have had several programs of integration, but as I said, I think that's one of our problems because of the structural problems of the country, really, but also because of the series of crises that we were facing. But I think there was an investment to respond to those social disadvantages, yes, with a relative power of intervention, because the country has problems at a more general level. But I totally agree with you that that is one of the biggest structural factors for drug addiction. And the studies show that even when people develop problems in using drugs, those who are in a social disadvantageous situation face cumulative factors that make it very hard to leave the situation. Yes.
Thank you. Marie, and then Cassia after Marie.
Yes, thank you very much for the question. I agree with what Marta has just said. The studies show that problematic drug use might be higher among people who are in situations of poverty, just because they are facing very difficult situations, but also because the impacts of criminalization have really focused on those most vulnerable and marginalized. So we also shouldn't underestimate the impact of drug policies on levels of vulnerability towards harms that could be associated with drug use. What's interesting is that many governments have recognized that already, and many civil society colleagues have recognized that. And what's really important and interesting about harm reduction is that the harm reduction response is not only focusing on addressing the health issues related to drug use, but they also and increasingly focus on the social issues that people might be facing. So, for example, providing housing first, or providing food or showers, or issues with gender-based violence. So harm reduction addresses all this. And as Marta said from the very beginning, it's really important that decriminalization is associated with harm reduction, and harm reduction encompasses so many different things than just addressing the very limited health harms that people might be facing. So I think if Ireland moves in this direction, addressing the social issues is also incredibly important, and that can be done through harm reduction.
Thank you. Cassia?
I very much agree with my colleagues. I think that's a great question. Thank you for it. When you think about people who are unhoused, it's really not that surprising that drug use becomes an issue, because in some sense it's a rational response to a terrible situation that people are in. One point that I would like to make, just in addition, is that if folks then become criminalized, it will become that much harder for them to return to society. In the United States, for example, if you have a criminal record, you cannot access public housing. There are many jobs that are unavailable to people who have a criminal record. So just in addition, I would invite you to think about the cost of criminalization once people actually do want to or are able to return to society and are being kept out.
Thank you. Marta, did you want to come back in?
Yeah, just to say to give an example of a program that existed in Portugal after the reform was implemented. For example, to improve the employability of people using drugs in treatment. And what the program did was that those offering care to people using drugs in the treatment centers would work closely with, for example, the labor market, and during the period that those people were integrated in their labor and their employees. And at the same time, the government would give tax benefits for those enterprises who would welcome those employees. And the results were really, really very enthusiastic. But then the austerity measures came, for example, and the program was over. But we had a very good experience with this. Once again, user-friendly measures are to be implemented with the help of people using drugs, telling us at all times what are the best responses to put in place.
Thank you. There's one last question, Chair. The issue, and I'm not sure how Portugal have come to this, but for people who have past convictions. So when you decriminalised, there was people who had convictions pre-decriminalisation. Now, would they expunge those convictions, or how did you deal with the historic convictions of people after decriminalisation?
Thank you. And I'll just go to Marta for that only. We've only time for one response, if that's okay.
Well, I'm not sure about the response, so I would rather not respond. It's a detail that I don't really know how to answer, but I'm quite sure that a Portuguese colleague of mine will be in the next session, and those questions can be answered by him with property. I'm afraid that I don't give the best answer. Thank you.
Ms. Nougier, do you have a response to that? We do have somebody next week who is definitely equipped to answer it, but I think if Ms. Nougier has a response, that would be great.
Not necessarily on Portugal, but there are a variety of jurisdictions that have allowed for the expungement of criminal records for people who have been previously convicted of drug use-related activities. So that is definitely something that's happening around the world, but I'll let the experts respond on Portugal.
Thank you.
Thank you very much.
Thank you. Next up is Deputy Horgan.
Thanks, Chair, and welcome to our witnesses. I have two questions specifically. One is short and specifically to Ms. Nougier, and then the second is maybe for everybody. Ms. Nougier, in your opening statement, you talked about the 6 aspects that you would like to see covered in this kind of work. And something that I wanted to go back to was the involvement of drug users in the development of policy. We have had our own departments, both from the health sector and the justice sector, in discussing this in previous sessions, and it's just, in their description of policy development, most of the advocates from the sector who could be categorised as those experiencing the issue, so drug users, are often in the category of problematic drug use, so addiction, and those maybe representing families of those who are in addiction. I'm just wondering, in your experience, is it important, or are there examples of both problematic and non-problematic users, possibly casual users of drugs, being brought into the development of policy? Ms. Nougier?
Yes, I mean, thank you. That's a really great question. IDPC is a global network. The key thing that we promote is the involvement of affected populations in the development and implementation of policy. So I would say as many people who use drugs as you can, definitely people who are casual users, definitely, absolutely people who have maybe a criminal record, people who have problematic use. You need to have a variety of perspectives, because there are so many different perspectives in drug use, and people don't necessarily agree. People use different substances, use them in different ways, in different settings. There are people who use in festivals. There are older people who use at home. You don't know, right? So I think the more perspectives, different perspectives that you can get in the development of a decriminalization policy, the better your model and the least negative consequences you will get in terms of its implementation afterwards. So definitely, please involve
Just
as many people as you can.
As a mini follow-up to that, who would we reach out to? Is that student organisations? Is that self-identifying advocate groups? How do we find people who self-identify as non-problematic drug users?
So in this question, maybe the case of Mexico could be interesting. So Mexico, in the lead up to the UN General Assembly special session on drugs, so this is something that happened in 2016, and that was a big deal in terms of engagement with civil society, and Mexico decided to put together a series of hearings with civil society to get their perspectives on what they're expecting the government to bring to that big UN meeting. And the government just released a public call for expressions of interest from civil society, and civil society could respond to that. So I think if you, first of all, reach out to all the civil society organizations that work on drug policy reform, you'll already manage to get a lot of contacts of people from very different environments. You also have Students for Sensible Drug Policies and Youth Rise. These two organizations are youth-led organizations working on drug policy reform and harm reduction. So you could reach out to them. There's global networks of people who use drugs as well who can help you out, and regional networks of people who use drugs. There's a European network of people who use drugs, for example. So there's a variety of different avenues where you can do that. I'm sure all of us would be happy to help you identify a few of these colleagues, and then as a ripple effect, you'll be able to identify many, many people who'd be willing to engage, both casual and problematic users.
Thank you very much. That's incredibly helpful. I want to kind of stay on that theme then, but broaden it out to our other witnesses as well, which there is, I suppose, a complexity with navigating for policy between problematic and non-problematic drug users. That particularly seems to be an issue when we both have either a criminalisation system or a decriminalisation system. Obviously, under legalisation, you self-identify if you require addiction support. But under both of the other models, criminalisation and decriminalisation, you're likely to see, for example, diversion programs which complicate the issue of how you navigate, how you make a differentiation between people who are truly
problematic users of drugs and those who are not problematic. And certainly in our previous committee sessions, we have talked about incentivising people who are not problematic to take up space within the health system because there might be a legal benefit to them doing that. So that is a concern of mine, that we would be incentivising non-problematic users to go for treatment that they then maybe don't need and are taking a place from somebody who does need it. I don't know who wants to come in on that.
If we go to Cassia first, please.
That is an excellent question, and a really important one. So the reason why we are advocating, and my institution is advocating for decriminalizing rather than diversion, is decriminalization removes involvement with police from people's lives. Diversion actually continues police engagement, and police who are not qualified to actually make decisions who is drug dependent and who is not often end up arbiters and referral points for people to treatment. And that is not where we want to be. Ultimately, and I think both Switzerland and actually Czech Republic and Portugal show it clearly, that people will come forward for treatment when they're ready. And that is when treatment is most effective. If people are pushed or forced into treatment, it's very often not helpful to them. So, and yes, the question of 90% of drug users who do not need to be in treatment, being forced into treatment, is a complete waste of public resources. I would say what I would really want to stress is to say that people know when they are able and want treatment, and we should, rather than being frustrated that they don't want it sooner, we should honor that. And that is the best, that approach is really the best approach in terms of using public resources and honoring people's autonomy.
Thank you, Cassia. And very briefly, Ms. Nougier.
Yes, thank you. I was just going to complement what Kasia just said. I think it's really important to understand that not everybody requires treatment. And also, maybe many people will require some level of support and harm reduction. In every single case, criminalization has a severe impact, negative impact on people who use drugs, whether they are dependent or whether they face problematic or occasional use. So decriminalization is critical for everyone, and we do want to remove the interactions with the police because that leads to some level of, negative interactions, harassment, discriminations, many cases, violence. So the idea is to get this out of the criminal legal system, out of the hands of the police and into the hands of people who use drugs themselves. And if they need it, they should be able to have access to the health and social services that they need. For example, a woman who uses drugs occasionally, who needs to go to sexual and reproductive health services. Being a person who uses drugs or who identifies as a person who uses drugs will be detrimental to her health and the health of her unborn child. So would you like her to continue being criminalized even for occasional use? Or do you want her to be able to have access to the health services? So, it's not just having access to treatment services, it's having access to a whole range of services that they are denied.
Thank you. Ms. Pinto, I might come back to you in my round because my questions are in a similar vein. So I reckon that maybe if I hold off onto that on your response till then, Senator Siri Carney.
I'm curious to know what you're going to ask.
It's similar to
I'm going to be slightly different. So first of all, thank you very much for taking the time to be with us this morning. I think this has been hugely educational. I am old enough as an Irish person to remember a time in our society when being gay was illegal, and we have taken such a human rights societal change that in my lifetime we've gone to a place where I stand up and argue for same-sex couples' parenting rights. So, and that is a really welcome, fantastic growth in our society of inclusion. So I suppose I have that in my head of thinking societal change is very possible in Ireland and can be argued and can be brought in, and there's no question but that. So I approach this with that same view. However, I find myself in very conservative territory. And so I'm challenging my own conservatism, I suppose. We have a health research board within our Department of Health that produces figures that demonstrate that drug use is the same across all sectors of society. It's just maybe different drugs are used. So if you go to the more affluent end of our society, you're dealing with probably cocaine use, where there is problematic usage, it can be better covered up, it can be paid for with private treatment, and it's more socially acceptable. Then you come to socially deprived areas of our community, and the access, the drugs that are used are less socially palatable, let's say, from a perspective of opioids, and then the association of crime and access, high levels of crime. So I am completely 100% already there that we need to decriminalise the individual. We need to steer people on a pathway of health over anything else. I see it in vulnerable communities where the instant criminalisation of possession does no use. It is an absolute failure. But I suppose I'm wondering about a future where we take the brave step of regulation. So I'm completely there on decriminalisation. I'm curious and want to push myself towards regulation. What would that look like? How would we get there? I don't want to say that we should arrive at a stage where all of our social services, our youth work, our investment in socially deprived areas has to reach X bar and have those outcomes before we could even consider regulation, though the sensible and the fear for communities to be exploited puts me at that place of saying, well, we would need to show a lowering of poverty, because in those societies, vulnerable families are exploited. Single parents have their children exploited as drug mules. The loophole or the correct attitude of our criminal justice system is, if you're under 18, you shouldn't carry a criminal record into your adulthood, and so that's exploited by drug gangs in the use of children in the whole dissemination of drugs. So I suppose I'm trying to get my head around, and I'm sorry I'm not as eloquent and as far down the road as my colleagues on this committee, but just trying to get my head around the stages that bring us to a place where we'd regulate. And at the same time then, I see they've regulated in New York, and from a place that I would have once enjoyed going to, my most recent experience of going to New York was one that I would never want to repeat, where a father and mother and an 8-year-old child are approached on the streets constantly to sell cannabis. The smell of cannabis on the streets is just incredible. So that makes me think, oh, well, I certainly don't want to go down that route. So I don't know, help me in moving myself to that place. And I'm sorry, I've talked too long, but I'm just trying to articulate it.
I think it's well articulated, and I think maybe if I go to Cassia first, and maybe to maybe throw a hint, I suppose, at, regulation, but also looking at those other areas about open air drug use and how many different things can, I suppose, be regulated within a regulation.
It just feels like such a matrix that we can't get under the bonnet of, and I just find that difficult.
You're on mute, Cassia.
Yes, a couple of quick thoughts. And I raised my hand because New York is my home at the moment. So I'm happy to speak to that. So there's a reason why cannabis goes first. And the reason why cannabis goes first is because it is the most used drug, most frequently used drugs. If you look at sort of the scale of drug use across the world, across the country, cannabis takes the primacy. So, and you can learn from experiences of others. I would look at Canada. I would look at a couple of states of the United States. So cannabis, we have so many examples. And, there may be, as Marie earlier mentioned, you may want to consider social clubs rather than the full regulated market. Now, there's also a reason why heroin is made available by the government in Switzerland and in Germany and other countries, because that's a drug that causes overdoses and may potentially cause death. So I would say that the two drugs to start with are cannabis and heroin through medical prescribing, for those reasons. Now, New York. I'm a little concerned that this is how people see New York, partially because if people went to New York, San Francisco, Oregon, and a couple of other states, they would have had probably somewhat similar experience. I'm not sure that New York is really the worst, but maybe that's my hopeful perception, because that's my home. Now, New York has struggled with the fact that it tried to regulate cannabis in a very specific way. It took a very long time to set up actually models of regulation that are social justice aware. And two, New York made a very conscious effort just to stop arrests. They felt like, so even if people are selling illegally, they made a choice as the city to stop arrests and stop harassment of people. I actually think that you should ask those questions of New York and state regulators, why they've made that choice, and maybe you wouldn't make that choice. Maybe you would have, you would have dispensaries and shops, and actually still continue arresting people outside. But for numerous reasons, some of them having to do with social justice and race, actually, New York had made that choice. And there's sort of two ways to understand it. But again, I want to say that there's now a lot of fantastic experience. And if you are taking that path, I would strongly suggest, we're very happy at OSF to host you in the US, invite you to a couple of states where they have different approaches, and make a judgment that would work for you.
Thank you. We'll request that the committee funds us visiting all the states, just so we can...
I'm up for that.
Just so we can be fair and we can redeem New York's reputation. I think that would be good. If there's anyone else want to come in on that, we don't have much time, but we can, I suppose, loop Ms. Nougier very briefly.
Yeah, very briefly, just to say that there's 2 points. So one of them is obviously legal regulation will not solve poverty issues. I think we should be very clear about what decriminalization can achieve, what legal regulation can achieve, and obviously, state services, funding, access to education, access to services. This is, operating like legal regulation will operate within these state, policies as well. So legal regulation will not be able to sort out all poverty, but it will be able to remove certain layers of criminalization and vulnerabilization, I don't know if that's a word, vulnerabilities that are faced by some of the most marginalized populations. And secondly, there already exists a market. It's illegal, but the market exists. And I think we need to face that reality. So it's really important to also consider the power dynamics that operate within these illegal markets and see how we can redress some of the violence or oppressions or, inequalities, whether it's class, gender, race inequalities, and make sure that we address these within the legal market, because that's not a given. It requires serious thinking, and that's what Kasia was saying with the state of New York and Massachusetts and Oregon and other examples. Like, we need to kind of understand these and see how we don't perpetuate these problems of these issues basically in the legal environment. So I think this requires a lot of thinking. It's complicated, and that's where you really need to engage with the affected communities to really understand what their issues are and how the state can actually redress them adequately.
Thank you, Ms. Nougier. And we will have time for a smaller second round of questions, but I might ask some questions myself before we move on. And I suppose just there's a few things that have come to mind, like they always do when you're listening to the conversation, and it's hard not to want to come back in on every single thing. But I suppose one of the things that I do want to really get to the heart of is, and it's definitely been a trajectory of my own evolution of thought as well when it comes to drug policy, even though I've obviously had very early involvement with drug policy for many years, my own thinking has also evolved, which is obviously always a positive thing, because, you know, landscapes change and different countries try different things, so you start to see what works and what doesn't. But one of the main things I think over the last number of years that I've really began to integrate, I suppose, into my own understanding is a rights-based approach to drug policy. And where I've kind of come to that now is that that's different than a health-based approach. Like, unless the health-based approach has full rights-based approach inbuilt into it, well, then it's not actually a health-based approach. And so before I would have very early on been looking at diversion and then looking at Portugal and looking at dissuasion. So really I want to go in maybe on that dissuasion piece at the moment, and maybe picking up Ms. Pinto as well. And you have underlined, I suppose, in your contribution where it says dissuasion for drug misuse. So it doesn't say dissuasion for drug use. So I'd really just like to maybe tease that out a little bit in terms of what is exactly happening in relation to that area, because I think obviously there's fears that we won't be able to meet the need, and it goes back into Ms. Horgan's, Deputy Horgan's contribution, where she was talking about people using the system and availing of treatment that don't need any treatment to evade any sort of legal sanction. But then there's that piece around even dissuasion of somebody who is in misuse of drugs. So that's still a target, I suppose, on the most vulnerable that we all talk about, but then they will be the one targeted in most systems that we look at, even if it's just looking at the dissuasion of misuse. And I think we can all agree that we would like to make sure that people are offered all the supports necessary for drugs misuse. But what I want to really get to the heart of is, what does that look like in terms of a rights-based approach? And are people sanctioned for not actually availing of any support or attending meetings? Because my fear is that any dissuasion that has sanction in any shape or form at any stage associated with it is not actually a rights-based approach. And I'm just wondering if maybe Ms. Pinto, you can come in, and if anyone else has any contribution that can add on to that, that would be great.
Okay, thank you very much, Senator Lynn, for that question. Excellent question, and I'll be very happy to answer it. Well, we have learned, because we already have tried, that mandatory treatment is not effective. It's not a good solution, so people should not be forced to go to treatment. Whenever I agree with you, I don't appreciate the term dissuasion nor the background, although I like that it's not targeting drug use but drug misuse. And I agree with you that sanctions would not be, in my opinion, the best way to approach the problem. We should help those who have a drug addiction and want help to deal with it. But as Kasia already said before, the major majority of people using drugs do not have a problem with them. So those people should be approached by harm reduction, user-friendly, non-judgmental approaches and services, who are many times, by definition, outreach teams that go to people where they are, where they live, and they are open to address drug use, taking in consideration what Marie Nugier also said before, the personal relationship that any adult constructs with the substance, and that's an idiosyncratic thing. I would like also to address this issue, to go back to what Senator Sari Kearney said before, and she was saying that drug use is across all levels of society, but we know that, as I said also before, socially deprived sectors are the ones being proportionally affected by drug addiction. So For those people, we must put in place right-based approaches, taking in consideration the social deprivations and making a very, very serious investment in addressing the structural interventions that are absolutely necessary to take these people off poverty, or at least to apply protective measures to make to protect them from the effects of the disadvantageous conditions in which they live. So I would agree with you, dissuasion, sanctions and so on would not be, in my opinion, the best way to approach drug use, and it's not a health-based approach, although many of the people who go to the dissuasion commissions say they have had a good experience, and they, from the studies that we have, we know that, and they thought about their relationship with drugs. But we don't have to address those issues with penalties or sanctions or so on. We must adopt a harm reduction approach that is symptomatic with the way how people deal with their substance use. I don't know if I was clear.
No, I think that's good. I think it captures that there's, you know, many people can have a positive experience with dissuasion, but it's uncoupled from sanctions. So it's very much they were willing to engage, or the supports were there for them to engage. Cassia, I might go to you next, and in relation to but along with the answer that you're going to give now, I just want to pick up on the Good Samaritan piece, the Good Samaritan law within your contribution. I think I have looked at Good Samaritan laws previously in, I think it's Canada actually, in relation to overdose, and I'm aware of a number of people throughout my lifetime who left the scenes of overdose out of fear of being arrested, not realising that the person was going to die, and they did. And I'm just wondering, in relation to that Good Samaritan piece, is that the legislation that you're actually referring to, or is there a much more expansive understanding of what that is? You're on mute.
I'll answer that first and say that I'm sure many of you have seen in the U.S., you know, dramatic movies where someone drops a person who overdosed in front of an emergency room and runs away because otherwise, if they stay with them, they would be charged with possession, or even in some instances with murder if they were the ones that provided medicine. So the Good Samaritan law allows for people who called to actually stay with the person and not be charged. And that's an incredibly important law. But again, that law is put in a context of a criminalized environment. Because if possession was not criminalized, then that wouldn't have happened. There would be no need for it. And so I think it's incredibly important to understand that within a very punitive system that functions in the US, and it's incredibly important. And I don't mean to get nostalgic, but I just want to share one thing. You know, in my process of supporting harm reduction programs throughout the world, I have traveled to, you know, Tomsk in Russia, where it's minus 30 degrees Celsius, and it is always just amazing to me that drug users get on the bus and, you know, pay the ticket and travel in this terrible cold to make it to the harm reduction program because there's someone there who is non-judgmental, who offers the services that they need. When you think about that, it takes a lot of effort, you know, in the most remote parts of the world for drug users to come and seek help in an environment that's not judging them. And so my plea to all of you in Ireland would be trust drug users to come to ask for help that they need, that they're able to accept once you decriminalize possession. People know what they want. Forcing them simply does not work. Now, just on Portugal, and I'm sorry, I hope it doesn't sound unkind, I'm a big fan. Let's keep in mind that Portugal law was set up 20 years ago. I think we should learn from it and set up a decrim law for the current century. And I really hope and trust that Ireland will lead us there.
Thank you, Cassia. I know others want to come back in, but I might wait and come back to you just because we've gone a few minutes over time there. I'm going to go to Senator Fitzpatrick.
Yeah, thanks. Can you tell me where exactly cannabis is sold in Portugal? Like, where do you go to buy it?
Ms.
Any
Pinto?
of you?
That's a very interesting, interesting question. You can buy it in the streets, as was said before. You can also buy it by telephone. You may ask for it. You can buy it from your social informal networks. Usually, the people who only use cannabis, or, for example, amphetamines or drugs like that, don't usually go to the most marginalized locals of the city. You usually do that to get heroin or cocaine products.
So why
I don't know if I've answered.
Yeah, no, that's fine. You've confirmed the impression that I have. I haven't been to Portugal recently, so I just wanted to get that clarified. I haven't been able to find. You've confirmed what I thought was the situation. Why didn't Portugal put in place, when it was decriminalising drugs and decriminalising cannabis, why did it not put in place a formal regulated process for the sale and supply of cannabis? At least cannabis, if not all drugs.
That's a very good question. I think that at the time, the commission that did this work was studying all the possibilities. I didn't think that, and maybe thought that was a huge step. So they should try a more conservative strategy. But as you know, we are evolving on the regulation of cannabis use. For therapeutic terms, it already happened. And for recreational use, it's happening, I think.
Okay, I'm going to go to Ms. Nougier and then Ms. Vass, please.
Thank you, and I'll be quick. I just wanted to say, for a very long time, legal regulation was just not something that governments would consider because it's against the international drug control treaties, which are currently actually creating huge barriers to governments responding to realities of their populations on the ground and moving towards legal regulation. But the drug control regime does create significant obstacles currently in terms of what governments can and cannot do. And I know that there are already some discussions at the highest levels in countries that have already legally regulated in terms of how to overcome these challenges with different sets of agreements internationally amongst the countries that have already legally regulated, seeing how you could remove cannabis from the drug control treaties or make reservations on the treaties. But that is definitely something that has kind of hampered the progress towards legal regulation. And obviously, I'm sure that these discussions will come up in Ireland when you start discussing legal regulation more. But that's definitely questions that do need to be asked, and there needs to be an answer to that.
Thank you. Ms. Vass.
Yes, thank you. I agree with everything. Just very quickly on the question of why Portugal did also not consider regulating cannabis earlier or from the beginning. I think one of the primary reasons, as was highlighted previously, is that they were primarily focusing on kind of addressing more problematic use of other types of substances, but that's also to the point that others have also mentioned already, that the Portuguese system also needs to be revised continuously. And it's in that framework that the discussions have been going for, I think, more than 10 years now as well, regarding what to do about cannabis to manage the harms of cannabis that are understood to come primarily from it being illegal currently. So sort of the motivation now for revising is exactly that, the harm reduction piece to manage for those factors that were not accounted for 20 years ago.
Thank you. I'll have to come back to you, Ms. Pinto, in a couple of minutes. I'm going to go to Deputy Gould.
Yeah, thank you, no problem. I suppose for Dr. Cassia, in your opening statement, you talk about decriminalisation, building trust between communities and law enforcement. Could you speak to this piece, I suppose, and how this trust was built?
Well, I think for most, I mean, if you look at the drug policy regime, I think law enforcement has been put in place where it has no choice but to arrest. And so when you have conversations with police officers, many of them will actually express frustration about it. That that they book someone, they take them to jail. There's a conversation with the prosecutor. The person is out on the street 3 days later, and then they book him again. So very often, law enforcement itself will tell you that it's a complicated process and that they don't necessarily like it. And it's a waste of resources, I think, as often Portuguese law enforcement says they're now able to focus on more serious crimes. And so, putting a police officer in a position where they can be helpful to a person who may be confused, who may be under influence of substances, rather than arrest them. I myself have seen a situation in Netherlands when a very confused person coming out of the coffee shop went to the police officer for help because they didn't know how to get to their hotel. That is potentially a role that law enforcement can play. They actually can be helpful to people. At the current moment, drug possession and use are criminal offense, that the same police officer would have no choice but to arrest the person. And so there actually is a reality in which police officers can be helpful, can help someone access services if that person asks for it, rather than, or point them to their hotel, rather than this continuously hostile relationship that they have at the moment. And so there actually is also a very, very quiet sort of displeasure by some law enforcement that they don't want to take on that role, but they really have no choice. And I think law enforcement in a proper role and community organizations and harm reduction services and treatment can actually function in a way that is supportive to people rather than punitive and rather than taking away their agency to take care of their own health.
Thank you.
Thank you
Ms.
for that.
Pinto is looking to come back in there. We only have 1 minute left. It's the second round, so it's much shorter. Thank you.
That's okay. That's okay. I'll be glad if we don't have the time. I'll be glad. I just wanted to reinforce what Cassia was saying, that we have to trust people who use drugs on their will to care about themselves. That's what I would say the biggest lesson that harm reduction has teaches us is that when they have the resources to do so, they take care of themselves. So we only have to put the resources available to make them accessible, and decriminalisation also helps a lot in that, and people will come for us for help. That's why, for example, the HIV epidemics among people who inject drugs has gone away, because we made the syringes available. We helped people to know how to inject safely, and they adhere. So that's a very important message that we have to give. Another thing related to what Senator Lynn was saying is that I just would like to share that a health-based approach can in the limit be somehow perverse. Because if you only focus on the health indicators, you will take care of people on that dimension. And if you forget all the other human rights that you have to address, what you do in the end is that you silence and you neutralize those people in the community. They become people who don't harm the others with the infectious diseases, for example, and yes, they can live longer, but many of the people that I interview, that I work with, tell me about many times about lives that they, in their words, they are senseless, so we must take that in consideration. So I totally agree with the human rights-based approach. And regarding the introduction of the decriminalisation in Portugal and not the regulation of cannabis, I would just like to share that at that moment, now it's easy to talk about that, but I remember I was a young adult then, and at that moment there was a very, very hard public discussion, and there was no consensus about this, so introducing decriminalisation was really a big thing, but now we need to go further. That's it.
Thank you, Ms. Pinto. Ms. Horgan.
Thank you, Chair. So I actually kind of want to stay on that issue that Ms. Pinto was talking about, because we've talked a lot about cannabis today, but I just want to return a little bit more to helping people who are in addiction take care of themselves, or drug users take care of themselves. We currently are just on the edge of opening our first injection facility in Dublin, which is the first one in the country. Which I welcome and I'm absolutely delighted about. However, I think in the future I would like to see that broadened to being a consumption facility, which would have an expanded remit. At the moment, it's quite a constrained approach, which is specifically around an injection facility. I'm just wondering from any of the witnesses who might have thoughts on this, if they could speak to the importance of facilitating a kind of a broader sense of consumption, I suppose particularly in view of the changes in potency to some drugs and the emergence of synthetic opioids and how variable the potency can be in those, but also from maybe a gender and a diversity point of view. I can imagine I'm in an area with a high level of drug use. Often they can be women with children, they can be women who are put into situations where they're at threat of sexual violence through their purchase of drugs. And similarly, from a migrant community, we also have a high population of new communities in Ireland who we welcome very much, but who are also in more precarious positions and do not find it as easy to engage with policing services where they might feel threatened, and particularly when drugs are criminalised. So I'm just wondering, could we have just a quick expansion of how consumption facilities might support those marginal groups?
Ms. Nougier?
Yeah, thank you, and congratulations on this. It's very exciting. We've been following this for a long time. So, I mean, there's many ways in which you can facilitate safe injection rooms. Obviously, you're at the beginning, so it will take some time to adapt. But in many different contexts, it's important to make sure that the drug consumption room is adapted to the needs of the local communities. And obviously, drug use patterns change over time, and the ways people want to use also changes. I mean, in terms of women, and I mean, any other group as well, like, safe injection rooms very often are a point for people to gather. So it's a point of contact with sometimes some of the most marginalized people who use drugs. And very often they come there to use, but they will also come to do laundry or to have breakfast or to seek legal support, or, so it's very important that all of this is being incorporated in the drug consumption room when you design it, and that there is room for flexibility to make sure that when people provide feedback on what they need, then you can actually adapt the services that are available to the needs of the people who are actually coming to the room. In some contexts, women have specific opening hours where they can come, where it's women only. And in other contexts, for example, in Barcelona, in Spain, there are harm reduction services that are specifically tailored to women who actually have a space for women to consume within the harm reduction space. So it's not a safe injection room dedicated to just that. It's actually becoming much more incorporated in the usual harm reduction spaces. And that's important in terms of offering flexibility as well, because women who are highly stigmatized might not want to go to the drug consumption room, but they might go to a harm reduction service that they are used to, where they can actually use safely. So that's also something to consider. Not everything needs to be incorporated within the drug consumption room, but it can also be a bit more flexible in terms of how you can incorporate safe injection or safe drug consumption in the harm reduction services that you currently have in the country. And that's also important in terms of outreach, because you'll have one drug consumption room in one place, but there are many people who use drugs who use everywhere, right? So it's just something to consider.
Thank you, Ms. Nugent. Ms. Pinto?
I would love to speak English like you do. Well, I love that question, and thank you for the opportunity to say this. The evidence shows very clearly that harm reduction is a fundamental strategy to deal with drug use in any national strategy. Nevertheless, it also says that we should not apply unique strategies. We have to combine them. The benefits from harm reduction are potentialized when you combine several responses. So clearly, a drug consumption room or an injection facility must combine different interventions, harm reduction interventions, and besides that. For example, it is important to help people to get in contact with their families if they ask for it, for example, to try to work their social inclusion. It is important to work with them if they are willing to. Their labor inclusion, let me share that evidence is showing more and more that we should not expect for someone to be without drugs to go for the labor market, to start working, even if it's not in a full-time period. And we are doing many experiences on that field that show us that starting to work is good for those who want to do that, and reinforces the capacity to manage drug consumption. I would share that, in my opinion, evaluation is a very powerful tool to mold, to shape the interventions. So we were talking about the health-based approach. And if you take a look to all the evidence that is being produced on drug consumption rooms, for example, you can see that you always have the health indicators to use the evaluation. Those are the most common. And sometimes you have, well, the public nuisance and crime and so on. You usually don't have nothing related to human rights-based approach. So if you create a project, a drug consumption room, with an evaluation that has indicators related to human rights dimension, it would be very important to shape the drug consumption room in order to avoid it to become a very constrained approach, as you said. And definitely, also for the needs evaluation and for the design of the drug consumption room and for the evaluation of the impact of the drug consumption room and so on, it is very important to listen to people who use drugs on how the drug consumption room should be, and include intentionally diverse groups like women, people with disabilities, and so on, to hear what they have to say about services specifically designed for them. I was only going to finish with two quotes that people from the drug consumption room in Porto brought to me while doing the evaluation, for example. One of them, but this is just a phrase that shows the majority of discourses that I got from there. I come here to the drug consumption room for the people, not for the drugs. And every time I come, I want to stay longer here. And other persons told us that they found there the family that they never had before. So this is the kind of service that we must provide to people, and this is the kind of service that attracts people to us. If we have services like that, we don't need mandatory responses, because those are not effective.
Thank you, Ms. Pinto. And I did visit the mobile consumption sites and that while I was in Portugal, and met the teams there who were great. So I'm going to have to come back to you, Cassia, in the next round, unfortunately. If I can just hand over to Senator Siri Carney, please.
And my question is very, very quick. From our last round, I'm wondering, you speak about law enforcement as hostile. And I don't deny that there are certain communities in which law enforcement here is hostile and stop and search, and there's whole risks that go with that in Ireland that are not ideal. However, there is a bit of a chink of light, in my view, because we have members of our police force on drugs task forces who work very well with youth workers, outreach workers, drug outreach workers, and who, where it isn't hostile, where it is supportive, where they come and they will speak about drug debt intimidation and how we can cooperate together to support families and to assist. So I wonder, do we have a something that maybe isn't present in other in other countries, that maybe we could look at making sure we enhance that? I mean, we have a resources and a personnel numbers challenge going on at the moment, but even in having a vision for the future of enhancing where, you know, our police force, they're called An Garda Síochána, which is Guardians of the Peace, because it's a different model. They don't carry arms. We have a different model of policing, and I wonder, are we missing something by not actually focusing on what is good and how we could enhance that?
Ms. Nougier, first, please. Yep. Can you hear us, Ms. Nougier?
Oh, I can hear you now. Sorry, the sound got cut. Can you hear me?
Yeah. Go ahead.
Brilliant. Thank you. Sorry about that. So yeah, I mean, this is a good question. There be a lot of training of police officers so they can understand what is harm reduction, what is drug use, what is drug dependence, you know, all of this. However, in no case should the police be the first point of contact for people who use drugs. The experience from every single country all around the world shows that this does more harm than good. And I think we need to acknowledge that. And even though, of course, you know, the police is not all bad, we're definitely not saying that. But we're saying that in the context of drug use, it's just not helpful. It's more harmful. And we need to acknowledge that and move on. Criminalization doesn't work. Punishment doesn't work. And, you know, the police's role, unfortunately, is in enforcing punitive measures very regularly, right? So I think we have to move on. We have to acknowledge that the police should not be the first point where people seek help. People should be able to seek help when they need to in the services that are directly directed at them, and not through the police.
I think I need to interject there, because that's not what I'm referring at all. You know, I think that we do need to move to a health model. There's no question about that. And we're not suggesting, I'm not for one moment suggesting that the police would be the first point of contact. But the fact is that the police in Ireland already very constructively engage. That while they are people who enforce the law, they actually already constructively engage in communities, in community policing, in youth diversion, in working with youth clubs, in working with young people to provide positive role modelling. There is a lot of positives. It's not as black and white as it appears in some of the narrative that I'm hearing from you. So I suppose I want to ensure that within this discussion and when we're ultimately writing a report, that we're not writing off a resource that we already have that could be enhanced and supported.
I think Cassia just wanted to come in there, and then I'll move on.
So I will just return to my example from the Netherlands. If a person with whoever that is, whether that's a bypasser or a sex worker or a person who is under the influence of drugs. If they make a choice to engage with the police officer should be competent to engage in a way that is non-punitive. Of course, if someone is overdosing, police should have naloxone and be able to intervene. So in a situation where a person makes a choice to engage with the police should be competent to do so and educated and know a lot about drug use and its consequences and how to help an individual. I think what we want to, and I think we want to promote that. Of course we do. You know, I would love to tell my 20-year-old daughter in college in Massachusetts, if you're in trouble, go to the police, right? But unfortunately, if possession is criminalized, that's not what I'm going to advise her, because if she goes to the police, then she's in trouble. I'm going to tell her to look for friends or other social services. So again, if a person makes that choice, it would be fantastic if police was responsive in supportive ways. And I think there are ways to do that. There's trainings, there's make sure that police themselves feel competent to engage with people. I think if we criminalize possession, we actually are making that impossible. So I appreciate your experience with your police officers, and that's fantastic to hear. And, you know, maybe one day we could be working with them, helping others understand the positive role that they could play. But for that, we need to remove criminal sanctions.
Thank you. And I think it is an important thing to think about, because I think the relationship between many young people, especially those from communities who ordinarily might not have a positive perception or experience of the guards, that actually removing the criminal sanction in the first place could maybe actually go a long way to actually some reparation historically in relationships. So I think it's an important discussion. I'm just going to move on to my questions, and I think so much was covered already. I don't think I really need to go into too much, and I'm more probably going to ask a question that probably seems, I think sometimes I can sound a bit naive, I think, in terms of what's possible, but I'm going to continue my life in that vein. And one of the things is that obviously regulation, I think, is a massive important step. I think I get somewhat anxious that people will say we need regulation, so therefore decriminalisation shouldn't happen. So I always want to make sure that the decriminalisation piece happens, because that's obviously about the individual. I think the regulation piece is a question about supply. And I think they should be often seen as separate, but of course have various different ways in which they intersect. So they are related, but can be unrelated maybe in just how we think about things. And then I think about being from a community and working within communities and all the work that I do within the prison system. And the drug dealing is often the activity that people are focused on, when actually when you grind down into it, it's the violence and the intimidation that wreaks the most havoc within the community. So it's then like, how do we begin to think about, if we don't have a regulated market, but still want to address the most problematic elephant in the room, which is in the way in which, and obviously drug dealing has layers. In my mind, it's like, can you create an ethical framework for the selling of drugs in one's community that avoids violence and avoids, and it was hard for policymakers to think about that, because then you're acknowledging there's an illegal activity that you're trying to have a discussion around how it's done ethically, and you know, many people won't be able to engage in that conversation. But if I was just to imagine, a scenario, so I'm probably more speaking as from my community work background when I think of these ideas, and the work that I have done with drug dealers in the past and the research that I've done with drug dealers, and it would seem that violence is actually causing the most destruction, but it can't be uncoupled in many ways from the fact that debt is created and the black market and all of that stuff, and how they're interconnected. But when I work with drug dealers who started drug dealing during the 1980s, 70s, and up, even forget the 2000s for a minute, but definitely up into the 90s, there was a very much a feel that drug dealers, even the local drug dealers that were maybe at the top of the rung in that regard, were more likely to, when they seen their next door neighbour struggle out with a local shop with their bags, would take your bags off you and carry them home. And there's something has changed in the trend in which the very presence of certain drug dealers or young men within communities, even their presence, brings around a certain perception or reality of threat. So I'm wondering, is there an issue with violence? And if we look at regulation, and if that doesn't happen within this year, but it happens in the future and it's something we're going for, is there something that we can do in the interim that's about alternatives to violence in the illicit drug trade so that we can reduce deaths? Because like Senator Siri Carney said, drug use exists across all communities, but it's poor young men killing each other for the drug use of more well-off people. Do you know what I mean? So it's like, how do we make sure that we reduce male-on-male violence, even if drug dealing is in the background, in the absence of a regulated market? And I know that, I don't know if that's slightly outside your policy kind of brief in terms of, but I'm just wondering if maybe yous are aware, and maybe Cassia, you know, you've travelled a lot on this issue, and whether there's any work being done within the illicit drug trade, but is actually about reducing the violence rather than looking at the illicit drugs trade itself.
So yes, thank you for that. Let me take that on and answer at least part of this question. So first of all, I very much agree with you that decrim, that you need to pursue decrim. And again, my advice would be that once that's in place, that you then consider cannabis regulation. And that one shouldn't undermine the other. And potentially heroin maintenance if opioid use is a problem and overdose becomes a problem for you. Now, on the question of violence, you know, it's a really important question. And if you talk to colleagues in Mexico and they look at Switzerland, they will say this: we are not interested in getting rid of drug trafficking. We just want it to happen in a way it happens in Switzerland, that no one dies. Right, so I think you really need to think about what is your goal. If you are clearly committed to getting rid of trafficking, then I think you're going to create, I mean, then not you, but then the activities related to it will create risks of violence. So I think a government needs to think really clearly about what is the primary goal, secondary goal, tertiary goal. If your goal is to reduce violence, then I think you need to work with your own law enforcement to understand that that is your goal, rather than going after petty drug trafficking, because all of this is incredibly connected. And so, you know, there are a lot of studies that say that the more expensive the drugs, that means the less of them is available. And that increases violence, because what people are able to make from trafficking is larger amounts of money, so they're willing to kill each other for it. There are multiple ways to think about this. I'm not an expert in it, but I'm thinking of an institution in Newark, in a city in New Jersey, city close to me, community safety effort, where they actually have focused on reducing violence rather than reducing number of illicit substances that were on the street. And that may be an interesting connection for you. The additional point that I wanted to add to this is that the reason why I actually have met them and engaged with them is because they came to us asking for naloxone. And I was a little surprised that community safety initiative would be engaging on public health. And the person who runs it, his name is Aquila, and he actually works with, helps gangs sort of, achieve ceasefire. And he said, listen, I don't want people to die in my community, whether of knives, of gun violence, or overdose. All of this falls under one goal for me: keeping people alive. And so it's a very sort of interesting intervention that has both public health and community safety working together. And I'm happy to put you in touch, because I think maybe that will be instructive. Again, I think there needs to be clarity of messaging to your law enforcement and also to people who sell drugs, that we will overlook, you know, petty sales of cannabis, but we will not overlook violence. And, you know, those networks are able to hear it if messaging is clear and if then activity from law enforcement is actually consistent with that. Because you can't say it, but then go after small sellers at the same time.
Thank you. I would appreciate the contact. It definitely sounds like it's down the street and where my mind is moving on a number of things. So we have finished our questions for today, and I'd like to thank our witnesses, Ricardo, Beatrix, Marie, Marta and Cassia for engaging with the committee today. Your contributions and answers, I think, have given everyone a huge amount to think about, but also a lot more questions to ask as we move forward. We really appreciate the insight, I suppose, to the knowledge and experience that you have both domestically and internationally. It's much appreciated. And we will adjourn the meeting for today until Tuesday, the 9th of July. Thank you.
Thank you.